Six to 18 months. What else do they skip doses?
No.
Do they share meds?
No. You should take it exactly as prescribed,
Why?
because it's not gonna be effective.
You can become drug resistant.
Causes drug resistance and it's not gonna be effective. Good job, ladies. Love it when a plan comes together. I love doing this with the seniors and all of a sudden I get the whole room answering the same answer. Why do we give aspirin to a patient having an MI? Antiplatelet. Why do I want an antiplatelet for somebody who's having an MI? Make the blood thinner?
Makes it slippery.
I want it slippery so we can slide in where it needs to be. And yes, we're not doing Mona anymore, now we're doing something stupid. We're doing Fono.
Is it true aspirin's not technically blood thinner? It just makes your blood thinner.
In your bloodstream, make your blood sticky. If it's an antiplatelet, then it would make the platelets not work, yes? Okay. We used to do what was called ONUM. All right, when somebody was having a possible MI. Oh, but his oxygen sat's 94, why do I gotta put him on oxygen? Because I want that last 6%. I want every little piece of hemoglobin in his body carrying oxygen. So we always put him on oxygen, then we give him what? We give him the nitro. What's the rule about nitro? Sub-Q, every 5 minutes. After the second one, do what? Call 911. And then we give aspirin. Now, I learned Mona. You guys were probably taught Ona. The latest thing is they're getting rid of the morphine and they're going to fentanyl. Okay? Because number one, fentanyl's cheaper. And too many people were getting over-sedated on morphine. Well, I'm sorry, it's a little easier to fix that than it is to go after fentanyl. Fentanyl will kill them faster. I don't know who decided that. I wasn't on it.
Oxygen first.
Oxygen, nitro, aspirin, morphine.
Oh.
However, you're going to learn that fentanyl is taking the place of morphine now. Nitro does. Vasodilator. I want those blood vessels feeding my heart open and happy. Blood can get through. Morphine also decreases the cardiac workload of the heart. It makes it so less oxygen is still efficient. And then, it's a pain reliever and it gives you a nice, happy feeling as you play. All right? For some reason, they're all pushing to fentanyl. Pisses me off. But you'll see. DKA. What do you know about it?
Diabetic ketoacidosis.
You told me what the initials mean. What's it patho?
Too many ketones in the body, so it's breaking down.
Why?
It's breaking down the.
Why? I'm going to sound like my grandson. Why?
Because your body doesn't have.
What's the matter? Is my sugar too high or too low? Too high. So my blood is what? Thick or thin?
Thick.
So how do I want to fix it?
Then the blood.
Your body's gonna start metabolizing.
My body thinks it's starving, right? So what is it going to do?
Then you utilize other sources of fuel, so muscle.
It's going to go after fat and muscle. As it's doing that, I'm spilling ketones into my bloodstream. It's cannibalizing itself. It thinks I'm starving, even though my blood sugar is 1472. All right? So if my blood is too thick, how am I as a nurse going to help myself? What do I need to do? How am I going to thin it out? No. No. It's high volume fluids. High volume fluids. Now I got to bring my blood sugar down. What am I going to do?
Now you can.
What type of insulin? Regular insulin. What route? IV. So we put him on an IV drip. Bring it down.
What week is this study guide?
DT. Deep vein thrombosis. What did I just describe? A blood clot probably in my lower extremity. What am I at risk for? Why?
Because the blood's not able to.
No.
There's a clot that's like.
It's a clot down here. How's it get up here?
everything travels up.
It's gonna break off. Remember, a emboli is a thrombus that went on vacation. He broke off and went and caused trouble someplace else, kinda like me going to San Diego. Okay? He broke off, he's causing trouble somewhere else. My head, my heart, my lungs. You with me? Digoxin. Okay, I'm gonna write some drugs on the board. Drugs are fun. Medications take a prescription. Some of those drugs look familiar? Sublingual nitroglycerin. Digoxin. Ever heard of him?
Yeah.
What's he good for?
Like arrhythmias.
It's better for too fast. Digoxin has two magic properties. It is inotropic and chronotropic. Chronotropic means it slows the rate down. Time, chronos. Inotropic means it makes it squeeze harder. So it becomes more effective pump. What's the rule about digoxin? You guys heard?
Don't you under 60? because
Under
they
60 would.
Patient will take blood pressure.
No.
Or your heart
Beats per
rate.
minute.
Where do I check it? Touching my boobs, guys. These are the girls. Who's this guy? Apical pulse for 1 full minute.
So it's the heart rate that we're looking for.
Heart apical pulse.
Why would you want it to squeeze harder if it's tachycardic?
I know, I'm trying to slow it down.
But
Did-
you
did-
said ionotropic squeeze harder, chronotropic slows time.
Yes,
So why would you want it to squeeze
more
harder?
efficient.
So it slows down like squeezing it. So it's
More efficient.
I think squeeze harder go like it's going.
No,
harder.
no.
So it's less
Okay.
squeeze harder.
Inotropic,
Patient will take.
more efficient pump. It's empty. Whoops, good catch, huh? One thing you need to know about lisinopril. You guys know the difference between the adverse effect and a side effect? Side effect I expected to happen. Adverse effect has potential to kill my patient. Okay? Lisinopril has, and I say it that way so you'll remember it, has a known side effect, and I don't really care about it. It gives you a dry cough. I don't care. It's a nuisance. That's one of the things you need to know about him. Okay? Warfarin, what's he do? What's the labs associated with them? I put them on the board before. INR,
Not a from 2 to 3.
2 to 3. What if I had a valve replaced?
2.5 to 3.
Good job. Theophylline. Anybody ever heard of him? Well, you better look him up. He's a respiratory drug. Prednisone. Steroid. Propranolol. It's a lol.
Beta blocker.
Albuterol. Asthma. We already talked about lisinopril and then verapamil. You guys need to know your mantras when it comes to.
What's verapamil? The same thing like listen.
I'm not gonna tell you. Rules surrounding a pacemaker insertion. I didn't get a chance to talk to you about pacemakers. Patient had a pacemaker put in. My favorite kind is the one that sits in the ventricle. When we put them in, they look like two poker chips, one sitting on top of the other. No, I'm not undressing. I'm trying to show you my clavicle. They sit right here. Subclavicular. Then the wires get swirled in so they sit inside the ventricle. Okay? And those pacemakers look, listen, and learn. Are you doing something? If you're not doing something enough, it kicks the ventricle back into shape and makes it fire. Okay?
That hurts, doesn't it, for the patient?
Not always. If they're misfiring too much, yeah, that hurts. I had one little dude come into me. This wire swirled down into my heart with these little bitty clamps that are hooked into my heart muscle. All right? I need that heart muscle to create scar tissue to hold that wire in place. But what if I decide I'm gonna go play some hoops with my buddies? Is that a good idea? What am I at risk for? Yeah, dislodging those wires. All right, so lifting above my head, playing some hoops. What else? Yeah, you better not have an MRI. Why? Because that big magnetic resonance imaging machine, it's got a magnet about the size of this room. It'll suck that thing right out of their chest. It's not funny. How to do.
Have fun.
Some of the newer phones have too big of magnets in them, and old-fashioned microwaves. And if I'm immediately post-op, you think I have a scrub on this? No.
Infection.
Pacemaker. The symptoms of peripheral artery disease, PAD. It's on that PowerPoint I showed you. PAD, peripheral artery disease. Yeah. Patients need to do about their inhalers, especially about mealtime.
They need to take.
Something like that.
Do it before they eat. What kind of meals should COPD patients eat? High protein, small diet. Small meals. Frequent small meals. High caloric, high protein. Why? Because they're spending all their energy.
It's for asthma.
What is it? Who gets it? What do we need to know about it?
Asthma patients, they need to take it every night before bed.
What kind of breath sounds would be associated? Would be associated with the percussion. What's percussion? When I percuss on somebody's chest. Percussion of a patient with chronic bronchitis. What's it going to sound like when I percuss him? You may have to look at your health assessment. During an asthma attack.
Or Buterol.
Yes, chronic bronchitis.
When you percuss?
Breath sounds associated with percussion sounds for chronic bronchitis. How else does albuterol help? Besides getting rid of the inflammation of the lining of my bronchus. What else does it do? It's gonna dilate. What else does it do?
Makes your heart beat faster.
Well, that's a side effect. Yeah, you get tachycardia. Decreases the mucus production. What kind of patient teaching do we need to give to a new diagnosed asthma patient?
Identify their triggers.
Know their triggers or stay away from them.
They
That's
need to
awesome.
know how to take their inhaler, they need to know to rinse out their mouth afterwards.
Good.
Spacer,
Oh, God, you're on it, John.
I tell you, my kids
Your
had
kids got
asthma
asthma.
too.
You had good nurses teaching you. All right, something we didn't talk about on digoxin is something called digtoxicity. Digtoxicity, the magic number to be digtoxic is greater than 2. To be digtoxic is greater than 2. What are the signs and symptoms of digtoxicity? Nobody ever heard this drill? No? Digtoxicity? All right, in a nutshell. First thing they're going to do is they're going to start seeing halos. They look at a light, and it's going to be like greenish or yellow halos. They're going to complain of nausea and vomiting. If I'm nauseated and I'm puking up my toenails, am I going to be wanting to eat? What do we call it when a patient doesn't eat? It's an A word, what is it? Anorexia. I can guarantee those are complex questions. Modifiable risk factors associated with atherosclerosis. You need to learn the difference between arterial sclerosis and atherosclerosis. I have to give sublingual nitro, right? Symptoms regarding left versus right heart failure.
L will always back up to the lungs, so you'll mostly hear lung.
Pulmonary.
And then right will be the rest of the body. So
There you go. And weight gain. 2 more drugs. Besides glucophage. Show anemias. I want you to look up Schilling test. Schilling test.
Is that for
Schilling, I promise. Labs for cholesterol, LDL, HDL, and glucose. My God, I'm not gonna have some senior come up and tell me that I didn't know the labs for the nerve glucose.
Said LDL, cholesterol, and HDL.
Cholesterol, LDL, HDL, and glucose.
Thank you.
Hyperkalemia on a tele monitor. How am I gonna spot it? And there's something else that's really gross that happens when heart muscle dies. When heart muscle dies, and they figured this out when I was a new grad, I thought it was the coolest thing. Remember, heart muscles are like brain cells. When they go, they're gone forever. You're not a starfish. They don't come back. Okay? When heart muscle dies because of the lack of oxygen, okay, those cells, when they break apart, they spill out, like I'm spilling something, they spill out very specific enzymes, okay? And they will spill out these enzymes at a very specific rate. So when we're checking to see if Mr. Smith had a heart attack, the doc's gonna say, did you give us any cardiac enzymes? And your answer is, of course I did. I ordered a CK, I ordered a CKMB, I ordered a troponin T, and a troponin I. Those are what we call the cardiac enzymes. Anybody a monitor tech? Yeah, you ever heard of order set of enzymes before? That's what they're looking for. So if the patient comes back with ST elevation, whoop, and now their enzymes came back positive, I can pretty much lay in my paycheck, he's had a heart attack. Does that make sense? So those are the enzymes we look at. And symptoms of hypo and hyperglycemia. Y'all better know that now.
Cold and sweaty.
What was it? I'm sorry.
Signs and symptoms of hypo and hyperglycemia. No.
Cold and clammy, give him candy.
Not 3 P's. 3 P's are diabetes. Hot and dry, sugar too high, cold and clammy, need some candy. They're goofy as shit, change of LOC, right? Remember my mom driving? Types of insulins. 3 in particular. Regular, Lantus, Lantus, and NPH. You need to know their onset, when do they kick in, and what is their peak time, P-E-A-K. And what's the big deal about that? Well, Mrs. Smith is a diabetic, And doctor says she needs 14 units of regular every morning before breakfast. So when should I give it to her? How soon before breakfast? 30 minutes. Why? Because that's when it kicks in. That's the onset. But what if Mrs. Smith is now nauseated? Is she gonna eat? No. What do I need to do? Give her some Zofran or call the doctor and say, dude, can I hold off on it? Just this morning? What if the kitchen calls and says, the kitchen's running an hour and a half late? Oh shit, I already gave her her regular. 15 grams of carbohydrates is how we treat hypoglycemia. You better give her a snack until that breakfast shows up, huh? Oh, wait a minute, what's an A1C?
3 months of blood.
It's a lab, okay, what's it for? 3 what?
3 months of.
Your average sugars.
3 to 6 months. It's a snapshot of your blood sugar management in the past 3 to 6 months. What's my magic number? Below 6. 6 or below. That's why when Uncle Dennis called, I called to check on Uncle Dennis and tell him insulin. At home, my vial.
Fridge.
Firm can be on the counter. But if the pharmacy gives me 6 months, the older vials, the vials that'll last longer have to be kept in the fridge. Soon before mealtime, I get regular, right?
30
What's
minutes.
the best way to manage gestational diabetes? There we go. Diet, exercise, and med, just like congestive heart failure. Prevent long-term complications from diabetes. How? No, I didn't ask them what they were. I said, how do I control them? How do I prevent them?
Control sugars.
Foot care. Maintain.
Stop the swing. Stop the hyperglycemia. Remember that big old glucose molecule beating up those little bitty blood vessels. Big deep breath. What do you need to do? You're gonna look for specific items that I've mentioned, yes? And you're gonna do what in ATI? Practice what? The next gen, because I want you to know how to negotiate it. Guess what? Those practice next gen questions are regular life questions. They're not medical. Okay? They're not nursing questions. They're like how to make a peanut butter sandwich. Okay? So go practice in those. Work on your study guide, okay? I can't let you out this early because Dean Scott's here and I'll get scolded. Yes, you hit the filter on what kind of test. You hit practice, and then just scroll down. It'll pop next gen practice. You guys really need to practice those. I do not want you messing up your next gen questions just because you didn't know how to negotiate. Where's this knife? Hit that. Thank you.
Practice the next gen questions and also study the information. Yes, I'm talking to you, myself.